Our trajectory is really great here at CMH. I think our future is really bright. A year ago, we started our 3-year strategic plan, and we're winding down year 1 of the plan, and we've made a lot of accomplishments. Right now, we're in the process of refreshing our strategic plan for fiscal year 25. Some of the plans from last year will continue into this next year. We started the foundation of some of our plans, and we're going to build on them. But there's also some new strategic focuses as we go into the new fiscal year that we're going to be focused on, and so we should in June be able to roll out our new and updated strategic plan for FY25. One of our focuses in quality has been to continue on our journey to high reliability, and that means wherever patients get care, anywhere they enter a CMH facility, they can count on what we're going to provide to them. And we've made a lot of advancements in governance of high reliability, ensuring consistency of processes. I really felt like that was evidenced through our Leapfrog recognition this year. Part of that high reliability work was ensuring safety for our patients, and just this last month we were recognized as being an A rating from the Leapfrog Group, which basically means that we're one of the safest hospitals in America, which we know that, but it feels good to have someone else tell us that and give us that recognition. Growth is really a big part of our vision always at CMH, because when we're growing, it means that we're providing more services that patients need here in this community. And so CMH has seen a significant amount of growth in the amount of services provided. We have a record number of surgeries, a record number of ER visits, a record number of clinic visits this year. Continuing to bring on quality physicians is always a focus for us. We've got several that are joining us in FY25, but the biggest growth, with our facilities obviously is our hospital expansion, and that now is starting to be where people can see it. One of our key focuses this last year was to increase access to care, and so a couple of the areas that we focused on, one was with screening mammograms. People ought to be able to schedule those online and be able to schedule those at their convenience, and so we really opened up access for mammograms for our patients, because we know early detection is better for our patients' health, and so we've seen a lot of improvements with that this year. We also really focused on access to immediate care through our walk-in clinics, and so being able to save your place online, to be able to wait at your convenience was really important, because we felt like people getting in earlier when they start to feel sick, it's better for their overall care, it's more convenient for them, and so we've implemented that this year as a part of that strategic plan. We've really been focused across the organization, but especially in long-term care, at hiring great staff that are completely committed to CMH and employed, and reducing our dependence upon temporary staffing. The reason we're really focused on that is we feel like our full-time staff, our part-time staff, are dedicated to our mission. When we bring our own employees in, they're dedicated to what we're doing here as an organization fully. They're completely committed, and they provide, a lot of them, they live here in our communities, they see the difference we make in people's lives, and it's just better for quality, for patient safety, if we're able to hire full-time staff, part-time staff, even our own PRN staff, instead of having to rely on agency staff. And so a lot of those efforts we put in place we're seeing fruit right now, and we're every day reducing the amount of temporary staffing we have to have on the floor. If we continue to be focused on the plans that we have, focused on the goals that we have, which really equate to better patient care, safer patient care, higher quality patient care, if we focus on those things, that's the way to greatness. And I really appreciate where we're at right now with our plan, where we're going to be, and I feel like we have all the right pieces in place to be successful for the future.